Hi, I'm Dr. Sarah Lekikatopoulos. I'm an emergency physician and a pediatric emergency physician practicing in Ontario, Canada, and this is my COVID diary. Before we get started, nothing in this podcast constitutes medical advice. My views are mine alone and do not represent the views of my employers or colleagues. By the way, if you missed our earlier episodes in this series, go back and listen to them first. This episode will make a lot more sense if you do. When I stitch up someone's cut, as I often do in the emergency department, they will inevitably ask me if they'll have a scar. Yes, I always tell them, you will have a scar. I'm very good at what I do, but I'm not a plastic surgeon. More importantly, even as I have my own limitations, so too does the human body. A good repair lessens the appearance of a scar, and given just the right environment, young skin, protection from sun, lack of infection, plenty of time, and maybe even some luck, the skin seals itself over and fills in the gaps. Maybe in a few years, the old wound will be completely undetectable. But I wouldn't bet on it. When I first learned about the Japanese art of Kintsugi, I couldn't help but see the romance in it. Kintsugi, which I'm sure I'm pronouncing completely wrong, roughly translates to golden repair. Practitioners of Kintsugi repair broken pottery by piecing together the shards with lacquer mixed with gold and other precious metals. The idea is to embrace the fragmented nature of the object. Rather than retaining an attachment to an irretrievable, perfect whole, Kintsugi highlights what has changed, creating something new, beautiful, and undeniably functional out of what remains. Now when I think about Kintsugi, I don't envision romance. It's not wistful, but practical. I still try to fix every laceration perfectly. I try to minimize each scar, but I try to break the news of the inevitable scar with the reassurance that it will be a beautiful scar, a scar with character, something that makes the patient mysterious or intriguing. And I truly believe it. One of my most recent patients was an elderly woman who had been trying so very hard to socially distance herself that she took up a solitary sport and went, colloquially speaking, ass over tea kettle. She had a large laceration to her face, and as I stitched her up as best I could, joking that I would return her soon to her career as a forehead model, she laughed along with me. Then she got very serious. I'll have a scar, but that's okay, she reassured me. It will be the new normal. Soon we'll all have a new normal. I think we will, I told her as I tied my knots. She told me that the old normal was gone, that we would never have that old normal again. But she smiled after delivering the grave news and told me that she would enjoy looking at her scar in the mirror. The notion of an irretrievable old normal is something I've wrestled with in recent weeks. I'm still newly in independent practice. I only became a full-fledged emergency physician 9 months ago. Normal only became normal for me, just as the threat of the coronavirus became real. It takes a lot to become an emergency physician, and 4 years of medical school, followed by 5 years of residency, still wasn't enough to prepare me for the daily realities of the job. It took 9 months to feel like I understood the referral patterns at my institutions, the culture of the group, and even which medications were available to me in my departments. I'm still not even sure I know everyone's names. But as normal became normal, I began to really grow fond of it. As much as I enjoy excitement, I am an emergency physician after all. There's a pleasant comfort in routine. Learning the processes, procedures, and people at your place of work relieves so much of the anxiety associated with working in a high-pressure, high-stakes environment. But normal isn't normal anymore. Emergency medicine training in Canada goes something like this. You enter medical school after your undergraduate or graduate degree. You spend 4 years in medical school, or 3 if you go to one of the 2 medical schools in Canada that don't take summer breaks and graduate students a year sooner. You spend the first half of medical school in a classroom, learning about diagnoses, treatments, physiology, and anatomy. You spend the second half of medical school rotating through a wide variety of specialties, both at your home school and at other schools across the country and sometimes even around the world. If you're interested in emergency medicine, you probably complete additional rotations in the emergency department. You go through the complicated matching process and start residency in an emergency medicine program. You then spend 5 years completing additional rotations and trying to learn everything there is to know about emergency medicine. The 5th and final year is spent madly studying for what is colloquially known as the Royal College, a cumulative multi-day exam that qualifies you to practice emergency medicine in Canada. It's a grueling exam that tests residents on everything from neurology to cardiology to obstetrics and everything in between. Importantly, there's a big portion of emergency medicine training that focuses on disaster management. The aim is to train us for the possibility of a mass casualty event, like an earthquake, bus crash, war, or nuclear catastrophe. For an unexpected loss of resources, as in a power outage or water main break, or for an emerging pandemic. In theory, we know how to handle deviations from normal. In practice, we do too. I'll be the first to admit that no individual, institution, or country's response to the pandemic has been perfect. The response to an unknown entity is going to be, by definition, a series of trials and errors informed by previous experience and theory. We must be agile and adjust our ways of living and practicing medicine based on evolving information. We are learning about COVID-19 as we go. Still, we've managed to implement rapid changes in the way we work, provide care, and live our lives over the past several months. It seems to have worked. COVID-19 hasn't hit Canada nearly as hard as we expected, at least not yet. I'm not an optimist by nature, so I still believe we have plenty of time to see the full effects of the virus. But it does seem that our country's commitment to social distancing and hygiene has had the desired effect. There's a vast chasm between handling the practicalities of our new normal and managing the mental and emotional realities wrought by the pandemic. Personally, I've taken some heat for encouraging people to stay home, avoid social gatherings, and practice careful social distancing. I've been told that I don't understand the impact this will have on the economy. Frankly, that's probably true. I'm not an economist. I'm an emergency physician. It's natural that I would be preoccupied by the effect of the pandemic on the physical wellness of my patients and potential patients, and by the strain on our healthcare system. And honestly, I think that if there is one thing we're not understanding, it's not the economic impact of the pandemic, but rather the mental, emotional, and social impacts. Even as I'm proud of what we've accomplished as a society in slowing the spread of COVID, I am aware of a growing restlessness. Some are calling for an end to social distancing measures. Others are taking to the streets in large gatherings and organized protests to decry restrictions on public life and travel. These are the most obvious examples of a growing unease, but I would argue that still more are covertly subverting recommendations in ways that, for all their insidiousness, are at least as dangerous. It's no surprise that a week and a half following Easter weekend, we began to see another spike in COVID cases in Canada. Sometimes the temptation of gathering with loved ones and participating in the old rituals is just too strong to resist. The explicit messaging of these small and large protests speaks to discomfort with government control of private bodies, to anxieties about financial and economic instability, to a sense that the cure is worse than the disease. It speaks to a skepticism about what we've been told is best for us. Maybe I'm a skeptic in my own measure, but I suspect that these protests belie a different sort of unspoken anxiety that has nothing to do with government control or economic instability. I think we're afraid of the new normal. I like to believe that the actions we've taken as a society have worked to ensure that the very fiber of our social structure doesn't unravel. But the reality is that this is only partly true. The other part of the truth is that social distancing has driven great fissures into the structure of our lives. Nothing is the same. It's okay for nothing to be normal for a little while. We've proven that we as a society and as individuals are strong enough to withstand serious disruptions in our daily lives. But there's a limit to what we can endure, and that limit is different for every person, for every family, and for every society. At some point, we tell ourselves, we must return to normal. At some point, we must be able to meet friends at a neighborhood cafe. We must be able to hold birthday parties. We must be able to operate factories at full capacity. We must be able to board airplanes, to visit family, to sit at the bedsides of our dying loved ones, to do all the sacred and profane as well as the utterly mundane stuff that makes up our lives. When we clamor in ways that are large and small, what we are shouting for is the return to a normal that we can't help but crave. We may fear government control or misinformation or economic devastation, but we also just miss the quotidian realities of pre-pandemic times. This brings me back to what my patient told me. The old normal is gone, and we'll never have the old normal again. Soon we will have a new normal. In 10 or 15 years, it will be impossible to look at our faces in the mirror and not see the scars left by this confusing, difficult, unprecedented time. We cannot expect to escape any of this unscathed any more than we can expect to fall on our faces and walk away without a scratch. Our society will be forever changed. Our world will be forever changed. Seems awfully philosophical and probably pretty sophomorically so for a podcast that's supposed to be about COVID, doesn't it? Well, here's the thing. I can't count the number of times I've sighed and moaned that I want my old life back, that I miss my old life, that I was only just beginning to relax into my old life when it was unfairly snatched from me. Yeah, I may be a full-grown emergency physician, but I can still be a bit of a baby. My heart is with the people protesting on the streets, crying out for a return to normal, veiled though that may be behind words that say, "Give me my freedom," but really mean, I'm scared and I miss the way things were. I feel for them, even though I firmly condemn their actions. I'm scared too. I miss the way things were. I want my old life back again, almost enough to take to the street with a big hand-lettered sign that asks whether things will ever be okay again. I miss wearing my comfy, personalized scrubs instead of scratchy institutional greens. I miss smiling at my patients and knowing that they can see my face unobscured by a mask, face shield, and goggles. I miss casually browsing the aisles at the grocery store and getting dinner with friends. I miss date nights and vacations. As everyone within a 10-meter radius of me is informed almost every day, I'm supposed to be in Taiwan right now. I was supposed to have been in Singapore last week. I'm struggling with the relatively minor disappointment of spending my birthday at home with nothing special to mark the occasion. But more than anything, I mourn the loss of normal. I felt profoundly sad when my patient told me I could never have the old normal again. I liked the old normal. I was just getting used to the old normal. I'm trying to imagine what the new normal will look like. I'm trying to see its scars. I'm trying to understand what it will be like if we, as individuals, as a healthcare system, and as a society, can highlight those scars, fill them with gold, and remember them forever. What will it look like if we don't try to paper over what the pandemic left behind, and instead stand back and let the fissures and cracks and repairs be their own kind of beautiful? But first, I may have to grieve a bit. I think we all may have to. So, where are we now? Well, as of May 1st, 2020, there have been 53,657 identified cases of COVID-19 in Canada. 3,223 people have died. In Ontario, where I live and work, there have been 16,608 identified cases of COVID. 1,121 have died. I want to take a moment to compare our numbers so far with the SARS outbreak of 2003. According to the Centers for Disease Control in the United States, a total of 8,098 people became sick with SARS. 774 died. Those aren't numbers for Canada or for the United States. Those numbers are worldwide. Already, we have twice the number of cases of COVID-19 in Ontario alone than we had worldwide during the SARS outbreak. Already in Ontario alone, more people have died of COVID than died of SARS worldwide in 2003. That doesn't mean that the disease is more deadly. On the contrary, proportionately fewer people who contract COVID are dying of the disease. But the breadth and impact on our lives and healthcare system far exceeds that of the deadly SARS virus, both in terms of numbers sick and dying, and in terms of the resources we require to keep people well. Many people have compared COVID favorably to seasonal influenza. We'll cover this in more depth on a later episode, but allow me to say this. The Canadian government reported 48,818 confirmed cases of influenza during the 2018 to 2019 season, the most recent flu season for which data is available. 3,657 people were hospitalized with flu. 224 people died. The 2018 to 2019 flu season was especially long. It was, in fact, longer than it had been during the previous 5 years. We all know that numbers don't tell the whole story. Differences in the way data for diseases is collected makes it difficult to directly compare them. But suffice it to say that already COVID has claimed 14 times the number of lives flu claimed during a recent and especially long influenza season. Working in the ED has been an eerie experience recently. The volume of patients visiting our departments has been lower than usual, but my experience has been that they're disproportionately sick. Moreover, people still have heart attacks, they still have strokes, they still get serious infections that aren't COVID, and they're appropriately cautious about coming to the emergency department because they're worried about getting COVID. Sometimes they visit us later than they would have under normal circumstances and are sicker than they might otherwise be. We muster all available resources to care for them. We're doing everything we can to protect our patients and ourselves, which means that there are very few visitors in the emergency department and that we're talking to our patients through masks and face shields, sometimes behind plastic or glass. The experience is a bit disorienting. We also don't know what will happen in a week or 2 weeks or a month. We have the sense of standing on a deserted beach, not knowing when or if the tsunami may hit. Will we be ready? Will we be strong enough? We just don't know. But we're grateful for the quick work of the public in social distancing and hand washing, and for our administrators' work in obtaining and conserving personal protective equipment. We hope we'll stand in good stead to meet whatever comes next. Before we end this episode, I want to thank Mary and Hugh. Mary and Hugh are the heart and soul, and more importantly, the brains of this operation. I could not record and publish this podcast without them. Thank you to my colleagues who are always looking out for one another and who are willing to listen to me nerd out about Bayes' theorem and its effect on COVID testing algorithms. Thank you to my patients who have been extraordinarily understanding in adjusting to all sorts of new procedures in the emergency department, and who have done their best to understand me even behind multiple layers of PPE. Thank you to Sebastian, who's tirelessly supportive and endlessly kind. Thank you to everyone doing the best they can in these strange times. I'll be back soon with another episode. Until then, wash your hands, don't touch your face, and please stay safe.